8:13, July 3rd, Wednesday morning. We got a special visit from Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, since tomorrow is the 4th. Morning, Dr. B. How are you?
Hey, Tommy, I'm great. Happy almost 4th.
Yes, sir. Same to you. Taking your medications on time and as prescribed is a very important part of managing your health, but it can be hard, especially if you take a lot of different medications. So Dr. B from People's Health is going to come on with us today to discuss the importance of sticking with your medication routine and share some tips for doing so. So, Doc, I guess we should start with, what does it mean to take medication as prescribed?
Yeah, really, it's pretty simple, Tommy. I mean, medication adherence is super critical. So taking your medications as prescribed really means just taking them exactly how your doctor tells you to. And they should educate you on exactly what that means and probably even prescribe you a list of what that means. But what it means is taking the right dose at the right times, and most importantly, not stopping your medication without talking to your doctor first.
So close enough, good enough for horseshoes and hand grenades, not medications.
Exactly.
What are some examples of not taking medication correctly?
Well, I mean, there's a lot of different things that I've seen people do. But, for example, if your doctor says you need to take one pill twice a day, once in the morning and then once at night, then you'd be taking that medication incorrectly if you did it any differently. So if you took just one pill a day or maybe 3 pills a day, some people will take both pills at the same time instead of splitting them up into morning and night. And then what I see most commonly is people actually just stop the medication altogether. And you don't ever want to do that. You always want to talk to your doctor to get approval to stop a medication. The other thing is, don't skip your medications. So, a lot of times it would be really incorrect if you decided to take it every other day, which I've seen people do as well.
I know one thing I'm guilty of myself is that you get the medicine and you take it and you feel better. So you say, why am I taking the medicine? So you stop when in fact you're feeling better because you were taking the medicine, right? Why does medication adherence matter so much, Doc?
Yeah, I mean, it is really critical, and a lot of people don't realize how really bad medication adherence is in the United States. And so this is a crazy statistic, but nearly half of all prescribed medications are taken incorrectly by patients. And even scarier, about 1 in 5 new prescriptions that are written by a doctor are never even filled or picked up by a patient. So we assume that they never actually started that medication. And so if you don't start your medications when prescribed, there can be a lot of really serious consequences. I mean, obviously it can make your chronic health conditions worse, can cause a really overall decline in your health and your well-being, and can even lead to hospitalization. So it's really why it's so important to follow your doctor's instructions. Your doctor is your partner in health, and really you need to listen to what they're saying. They know the safest way to take your medications to treat all of your medical problems.
And he or she is treating you based on the assumption that you're taking the medicine as they told you to take it, right?
Yeah, exactly. And, another consequence can be if they think you're taking your medicine and you're still having a problem, they may add additional medicine. And if they don't realize you're not taking the other one and you start taking it all of a sudden, then that can actually be over medicating you. So it's real important to make sure your doctor knows exactly what you're doing.
Don't lie to your lawyer, don't lie to your doctor. Let's talk about some common reasons that people don't take their medication as prescribed. And if somebody said the following statements, how would you respond? First, for example, I feel fine. I don't need to take any medication.
Yeah, I mean, like you were saying, we hear this all the time. People say, well, I don't need these medicines. I feel wonderful. But you probably feel wonderful because you're taking the medicine. And so if you stop it abruptly without talking to your doctor first, then you're likely to redevelop the problems that the medicine was intended to treat anyway.
One thing I've heard people say is, I'm not going to take that. I don't like the side effects.
Yeah, side effects are very real, and they can be actually pretty severe as well. So if you have any side effects that you think may be related to a medication, you want to tell your doctor about it right away. A lot of times we can manage these with either adjusting the dosage of the medication or maybe telling you to take it at a different time of day, maybe nighttime, so you sleep through mild side effects. We can even change the medication. We have a lot of tools in our toolbox, and so we may be able to switch you to a different medication that doesn't have those side effects that you're experiencing. The most important things is don't make those changes yourself. You want to talk to your doctor about those side effects so they can make the adjustments.
What if a patient finds out that the medications are a little maybe too expensive to fill?
Yeah, this is a really, really big problem. Don't just not take them. Talk to your doctor about it because there's always alternatives. Brand name drugs definitely cost more than generic versions. And there are a lot of generic versions of those brand name drugs available now, and they're usually available at a much lower cost. So make sure you speak to your doctor about what those options are. And then if you are on Medicare, you want to make sure you check to see if you're eligible for something called Extra Help. Extra Help is a governmental program that really helps you pay for your out-of-pocket drug cost. So people who have limited income or resources may qualify for this. You can actually just talk to someone at your local Social Security office, and they can tell you if you qualify for Extra Help.
Do people sometimes struggle with understanding how to take the medication?
Yeah, absolutely. And that's probably one of the most common problems. And unfortunately, people can be embarrassed about it, so they don't always want to talk to their doctor about it. But you shouldn't at all be embarrassed. Medication regimes can be, very confusing, especially if you're on multiple medications. So if there's anything confusing or you're not sure how to take something, just pick up the phone and call your doctor's office. You can even speak to the pharmacist. All the pharmacies will help you with those instructions, and they'll even reach out to your physician's office to get more specifics if they're needed. And make sure that someone writes down those instructions so that you don't forget. Because when you're on taking a lot of different things, you want to have a document that shows you, okay, this is what I need to do. It can be very hard to manage those multiple medications, even with those written instructions. So the other thing is talk to your doctor. There may be a way to simplify medicine, simplify the routine where you take them all at the same time. Rather than having to split up a lot of doses. So, like I said, ask your doctor. They definitely can help with that.
Let's take a break. We'll pick it up here. We'll come back talking to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, about the importance of adhering to your medicine and taking it when you're supposed to take it and how you're supposed to take it and following the doctor's orders, etc. If you have any questions, comments, 504-260-1870. Time now for traffic, WWL. 8:25, Tommy Tucker, WWL, on this July 3rd, talking to Dr. B, who's with us a day earlier. Chief Medical Officer of People's Health, talking about the importance of adherence to your medication and taking it when you're supposed to. And we've already talked about some of the things that people say about the side effects and their workarounds, or if you tell your doctor that. Somebody said, somebody else, the objection is, I don't need to take my medication. Well, I feel fine. Well, yeah, because you're taking the medicine. If it's too expensive to fill, there are options they can find out. As far as understanding how to take it, they can work out a regimen for you. You're supposed to take notes and follow what they tell you. Somebody else, doc, says they have a hard time getting to the pharmacy.
Yeah, that's a real problem, especially in some of our older adult patients, who may not have transportation or they don't live close to a pharmacy. So they've got to travel a far way to go there. So there's a couple of really simple things you can do with that. Mail order pharmacy is one option. There's a lot of those available, and they will ship the medications directly to your home automatically. So that way you just have to go to your mailbox and not actually to the pharmacy and wait in line. The other piece would be delivery pharmacies. We actually have several in our area. So you can actually talk with them. They can actually send medications directly to your door. And then the other thing is, once you're stable on your chronic medications and you're doing okay, no side effects, taking them as intended, ask your doctor about a long-term supply of that medication. Filling it 12 times a year is going to be much tougher than filling it just 3 times a year. So if you can get a 90-day or a 3-month supply, you don't need to refill it as often, and you're more likely to remain compliant on that medication.
What about if last time the pill was round and orange, this time it's square and yellow?
Yeah, this actually happens all the time, and it has to do with distribution of the medications. They're usually made by multiple drug manufacturers, and each manufacturer is going to choose its own size, shape, and color for the pill. But the actual active ingredient is exactly the same. So sometimes you will pick up a prescription and the pill will have changed. And so if that's concerning, you want to make sure you talk to the pharmacist about it or talk to your doctor about it. We actually have a little tool on our phone where we can snap a shot of the picture and we can confirm, that you're taking the right thing. So it never hurts to double check on that, but don't be scared to take it simply because it looks different. It's not a mistake. It's just something that happens in the distribution process.
You got a couple of minutes left, Doctor. Can you share some tips for sticking to a medication routine?
Yeah, I mean, it can be really tough, even for people who really want to take their medications correctly, but, they sometimes just forget. And so a good way to stay on top of those doctor's instructions is always to write them down, write everything down, how you're supposed to take it, what times of day you're supposed to take it, and keep those instructions with you so you can always find them. And that's even more critical right now. We're in hurricane season. So if you do need to evacuate, you want to make sure you've got those instructions really clearly written down. If you sometimes forget to take your medications, it kind of can help when you keep your medicines visible. Seeing it may actually help you to remember to take it, or even using something like a pill box, a brightly colored pill box in your room that will kind of trigger you to say, "Oh, I need to take my pills now." They even make pill boxes now with compartments for each day of the week and even multiple times during the day. And some of them will even have little alarms you can set on them to remind you. So there's a lot of little tricks you can do to stay compliant on your medication routine.
Some other ways to stay on top of it?
Yeah, I mean, like I mentioned, routine is really critical. So you want to try to take your meds the same time each day. That'll get you more in the habit of taking them. And so, for example, if you need to take something with food, always take it when you eat breakfast in the morning. If you need to take something at bedtime, maybe set your pills right near your toothbrush so you brush your teeth before you go to bed and then you take a pill. Really, the other big thing I kind of mentioned with pharmacies is take the guesswork out of refills. 90-day prescriptions, like I said, can be very helpful. But then also, most pharmacies offer reminder programs that'll either text you or send you an email to remind you that it's time to refill your prescription. They may even have an auto refill program that'll automatically fill it for you and just notify you that you need to pick it up, or like I mentioned, they'll mail it straight to you. So those can all help you stay on top of taking your medications.
Thank you, Dr. B. Hope you have a great 4th of July.
Thanks. You too, Tommy. Stay cool.
You too. We'll talk to you soon. If you want to find out more about People's Health, you can always visit the People's Health Medicare Center in Metairie. It's located at 3017 Vets, right next to Party City. Appointments are recommended, but walk-ins are always welcome. You can go to peopleshealth.com or just call them at 1-800-978-9765. 8:30, time for WWL First News.